Thank you. And yeah, I'm absolutely happy to answer questions as we go. That's the advantage of a small group. We can be a little bit more interactive. And in fact, I would love to know, maybe if just to put Patricia and Cam on the spot, but do you have any particular interest in the education, the training that goes on in addiction studies? What would be one question you would ask, perhaps, of someone like me?
Pam, would you like to go first, or shall I?
Sure. Yeah, and I've heard a lot of people talk about the program and how it's really unique, which I think is so interesting and so cool. I guess, what really kind of differentiates this, right? In terms of being that much stronger in the subject of addiction versus something like a more traditional like master's in social work, right? Like how does the programming kind of look different, or what do you guys focus in on?
Great question. Do you have anything to add, Patricia?
Well, thanks for asking, Shane. So I'm a parent. I'm older. And I've gotten certified in something called the Invitation to Change. And I'm a certified facilitator for those groups now. And I'm looking to just see what's out there in terms of continued training, education, how I might continue to build skills and possibly certifications to have impact in a really needed area. I'm at a point in my life where I have time for that. And I certainly have a lived experience, and I'd like to find a way to give back to the community.
Wonderful. Well, I'll get started, but I will just point out that we have a graduate of the program in the audience, Vinny O'Halloran. Nice to see you, Vinny. And Vinny's a great example of some of the things Paul was talking about, because I think he went through under that state program for, I'm not going to say older. Vinny is not at all older, but more mature, shall we say, students to take advantage of the financial support that the state gives. And he's also licensed. He was able to obtain his LADC licensure as an alcohol and drug counselor fairly soon after graduating. And I think we have now about 13 of our graduates are licensed from the first 2 years of the program. And as Paul said, we've been in existence for 5 years. So thanks for being here, Vinny.
Well, as always, thank you for your kind words. I like the mature word better than older, but yeah, I had my Uber hat on for about 4 hours, so that's why I'm a little bit late. But glad to join.
Thank you. Well, let me tell you a little bit about the program, as Cam was asking, like what differentiates it, and as Patricia was asking, like what sort of skills and certifications are you getting. So Western Connecticut State University, we're a regional state university. We serve students mainly in the northwest of Connecticut. We're one of the 4 sister schools. So we have Central up there in New Britain. We have Southern down there near Quinnipiac, and we have Eastern up there near Yukon. And in our psychology department, psychology is one of the biggest majors on campus. We have a faculty member, Nick Gallucci, who over 25 years ago recognized that there was a need for training for students to be certified as alcohol and drug counselors. And as you may know, in Connecticut, we have 2 levels of certification. So at the one level is CADC, and at the next level is LADC. So the CADC is a certified alcohol and drug counselor. You can get that with any undergraduate degree, and there's a certain amount of education and hours and experience and some testing requirements that you need to get that. And we were having students that were very interested in that, and so he founded a program. It consisted of 4 courses in the psychology program at the undergraduate level that provided all the education necessary for a CADC. Then, as Paul said, about 6 or 7 years ago, we as a department thought, we we'd like to offer a graduate program, but we want it to be in an area that is really needed. We don't want to replicate something that's already being done somewhere else. And we only want to offer it if we think it can make a difference. And Nick said, well, you know, what about taking this undergraduate curriculum that we have and turning it into a graduate curriculum? And we all thought that was an idea full of possibility. And we all recognized that the drug and alcohol crisis really in the US and in the Northeast wasn't getting any better. It was growing at that time. And so we began looking into it. And so we did several things. We talked to our students to see if they had an interest, and they did. I mean, many of the students said things like, wow, you know, a program like this would be just so impactful if I was able to go on and get a master's degree at Western. And then we talked to a lot of people in the field, agency directors, clinicians, and consistently what we heard from them was that there are not enough drug and alcohol counselors, that it's an area of great need. There's a lot of turnover, and the level of training is very inconsistent, or was very inconsistent. And they certainly were fully supportive of the idea of a program that would concentrate on training drug and alcohol counselors. So we began the process of putting it together. We basically begged, borrowed, and stole every good idea that we could find at any other university or college elsewhere in the nation. And to be honest, there's not many master's degrees in addiction studies, even in the whole country. It's not a common specialty. And we can talk about some of the reasons for that perhaps a little bit later, but we put together what we thought was a state-of-the-art program. And again, we got a lot of input from people like, you know, the directors of Connecticut counseling centers, MCCA, folks like that, because they were telling us this is what we need in professionals who are helping those with addiction. So we were able to build that in to our program right from the start. So what we ended up with was a 37 credit master's degree. You can do it in 1 year or 2 years. So if you do it full time, you can finish it, start in August and finish the next July. So basically in 12 months, you're able to get the master's degree. If you do it part-time, it takes 2 years. And for the full-time people, that's a heavy workload because they have to take 4 courses in the fall and 4 courses in the spring. And then they take a winter course and a couple of summer courses. For the part-time students, it's a little less stressful, I think, because they can take 2 courses in the fall, 2 courses in the spring, and then the next year they can do the other 2 courses in the fall and the spring. And so what do we focus on in terms of the skills? So at the core of the program, it's a counseling program. So we train our students in counseling methods, counseling techniques, counseling strategies. We give them a lot of practice. Vinny will remember in my course, probably the somewhat painful method of having to do a role play with a client and record it and then have it critiqued and some of the highlights shown to the rest of the class and so on. We're actually right now building a simulation program so that our students can work with simulation clients to practice some of their skills. And then there are specialty courses. So there's a specialty course in psychopharmacology. There's one in co-occurring disorders, you know, mental health and diagnosis and treatment. There's one in building and evaluating treatment programs so that people really know how to evaluate those from the ground up. There's a current topics course so we can sort of stay up to date with the latest that's happening. You know, just as an example, something that I'm sure you all know about, but if we'd been building an addiction studies program 10 years ago, we wouldn't have had anything on fentanyl in there because that just wasn't a thing. And this is unfortunately one of the problems with drug and alcohol counseling is that there's new problems that emerge periodically. And also some of the existing problems come in waves. You know, it seems like opioid addiction peaks for a certain period, and then more the amphetamines and cocaine and so on peak at other periods, and they go up and down. So current topics course, and then there's a professional development course where we teach ethics and how to be a professional counselor. But then I think really fundamental to the program is everybody does a 200-hour internship, and they place at many of those agencies that I just talked about, MCCA and Connecticut Counseling. But here in Danbury, we work with Apex, in Bridgeport, Recovery Network of Programs, Liberation programs. We have students placed at High Watch. We work with just a lot of different agencies throughout the state. And that really has been one of the things that I've been most pleased by, because my own training was not, as Paul said, primarily in drug and alcohol counseling. I'm a sports psychologist. At Rutgers, way back, I did do a lot of training in alcohol interventions. Rutgers was one of the first places that really started the behavioral interventions, the sort of controlled drinking, and sort of the first steps towards the approach that we know nowadays is the harm reduction approach, where you meet clients where they're at. And so that was really interesting, but I had not worked in that area for a long time. So I was I got to say, I was the graduate coordinator and program founder. And when we launched in 2019, I was nervous about how we would be received by the treatment agencies throughout the state. And I'm really happy to say that the reception has been fantastic. There've been collaborators and a great assist to us, and have come up with a lot of ideas of things that we've continued to build into the program. So our program is small. We are built around 15 students coming in per year. We could probably handle up to about 20, but we really couldn't go beyond that because of the lack of faculty that we would have. We would really need more people. So besides myself, I'm a clinical psychologist. I'm a cognitive behavior therapist. As Paul said, I got my PhD at Rutgers. I actually came to the United States some years ago to get my PhD because I had done my undergraduate work in Sydney, Australia. You can probably tell from the very slight accent that I still have left that I was born and raised in Australia. Then we have Nick Gallucci, who I mentioned earlier, who's been working in this field training drug and alcohol counselors for over 25 years. And he really, I think, really appreciates the opportunity to do now graduate training in this area. And then just last year, we hired Mary Murphy, no relation to me, but another clinical psychologist, a graduate of Yeshiva University, who worked with the App Foundation and Yale University and many other places over the last 20 years. And she has her LADC. So that's a fairly unique combination of backgrounds, is having the LADC and the clinical psychology PhD. So those are our 3 full-time faculty, and then we have a variety of other part-time faculty that teach specific courses. For example, in psychopharmacology, we have a neurologist teaching that course next semester who actually does prescription work and knows about the hands-on issues that treatment providers face when they're working with people in drug and alcohol counseling, because as you know, medication as a treatment is a very common strategy, particularly in the area of opioid dependence. So that's the program. That's the background of it. It's really been an amazing experience for me. As Paul said, it's been a journey. I've learned a lot about how bureaucracy works, getting a program like this up and running. And to sort of like finally address like the question Cam asked, what makes this program distinct is the emphasis on drug and alcohol counseling, right? So Paul and I have talked a little bit over the last couple of weeks about all the different types of licensures and degrees that you can get in the mental health field. And I realized to an outsider, it's confusing. I actually give a talk in my clinical psychology courses to my undergraduates every semester at the end of the semester after they've learned as much as we can help them with about graduate degrees and careers. And I call it the alphabet soup lecture because there's all these degrees you can get, MFT, LPC, PhD, MSW, and then there's all these licensures you can get, LCSW, LMFT, and LADC and CADC. So just, understanding what that involves is it's confusing, I think, for a lot of folks, and certainly for the students that we have graduating at Western. So I'd say that the principal difference is that our degree is really built around what is required to become an LADC in Connecticut. We built it from the ground floor up. We actually worked a lot with Jeffrey Kwame in the early stages, who's with the certification board here in Connecticut. And he really was very helpful to us and really was one of the people who encouraged us to get this program up and running. And if you do the traditional route, for example, of getting a master's in social work, you will do your 2 years training, and you'll get a lot of training to be a good counselor, and you'll get a lot of practice, and you'll do an internship. But in terms of addiction, drug and alcohol counseling, you'll be lucky to get one course. And that's if you're lucky. Like a lot of times, programs will have no specific specialized course in working with addiction. And that's because it's a mental health field, right? And there's just so many other issues and problems out there: anxiety, depression, family conflict, marital violence, and so on, that the practitioner would have to deal with. And the same with any of the other degrees that you could name. Professional counseling. We have a professional counseling program at Western. It's a 3-year program, leads you to become a licensed professional counselor. But again, their students take one of our courses and with us, and that's it. That's the only specialization in drug and alcohol counseling. Same with if you did a marriage and family therapy course. So you could end up in some of these, if you get training in some of these areas, you could end up doing your internship at a drug and alcohol treatment agency, and that would certainly give you some, boots on the ground type training. But we think what distinguishes our program is that we really focus on evidence-based interventions, and we teach our students to be critical evaluators of treatment approaches so that they can sort of make up their own minds. And by the way, I mean, that to me is the ultimate that I'm looking for in a graduate, is somebody who can be critical. And if their evaluation differs from mine on particular issues, I'm fine with that, because I just want them to be able to think for themselves and to look at the evidence and to try and know what works and how to implement that. And one of the things you really have to be in this field is a lifelong learner, because, as soon as you graduate, 5 years later, everything that you learned is 5 years out of date. And so you have to know how, what resources to keep educating yourself, how to sort of stay on top of the field. Continuing ed is a great way to help doing that. But we hope we give our students the skills to really be able to identify where good sources of information are, and really how to evaluate research. It's not an easy skill at all. I think Vinny could vouch for that the master's project course is probably, I don't know, a little bit like pulling teeth for some folks, but it is such a critical skill in this, particularly in this day and age, when you have so much misinformation out there that's readily available particularly on social media, that to be able to find good research, understand it, apply it, critically evaluate it, those are skills which really will stand you in good stead throughout your career. So when our students graduate, to get the LADC, they've already met all the education requirements. So you need 360 hours of education to become an LADC in Connecticut. Our program obviously provides much, much more than that. You need a master's degree in behavioral healthcare, And obviously our degree is one such example. An MSW or an LPC type degree would be other examples. And you need 2 years work experience. So the interesting thing about that with the LADC is that experience can come before or after getting the master's degree. So Vinny is a good example of somebody who had already accumulated a lot of experience working in the field before he came into our master's program. And we've had several students in the last couple of years that have come to us after, 5-year, 10-year careers as drug and alcohol counselors, but they just didn't have their masters. And so you need 2 years work experience. So once you have that and you can sign off on that, you also need a 360 hours of supervised practice. Well, you get most of that in our program through the internship and the internship supervision that we provide. And then you apply to the Department of Public Health here in the state, and you're able to get the license. Right now, if you look at the list of LADC licenses in Connecticut, it's a little bit over 1,000 individuals, but actually it's much less than that are actually practicing. As I said, there's a lot of turnover in this field. There's some really interesting things happening in the field too, in terms of there's a waiver, a new waiver that's come in that has had some interesting repercussions. And I'd be happy to talk with you if you have questions about like what are the job prospects, where do our graduates tend to get employed, what sort of salaries do they earn and things like that. But I don't know, your questions I think may be a little bit more concrete than that, or maybe you're interested in some other things that I haven't covered about some of the content areas that we train our students in. So I figured like around a half-hour introduction to the program, Paul, would be about right. And then I would open it up and see what sort of questions had. Perhaps there's some areas I wasn't really clear about that you would like me to clarify. But I think I'll stop there for at least the initial part of the discussion and see what questions folks have. Paul, do you want me to just sort of play the host for the Q&A?
You can play the host. Do you want to address what you were saying, some kind of waiver for the LADC? What's that about?
Yeah, so one of the things that is happening is that there's a push by the insurance companies mainly, and working with the various state governments to raise the standards for counseling that's given and offered to individuals with substance use disorder. So one of the interesting things about diagnosis in this field is that it has changed quite a lot, even in my lifetime. So when I got my PhD, we had DSM-3, and then in the 1990s, we had DSM-4. And nowadays we have DSM-5, and they're working on DSM-6. And with each new revision of the Diagnostic and Statistical Manual of Mental Health, you get slightly different conceptualizations of substance use disorders. And one of the things that is happening with this waiver is that there's a requirement now that if a treatment agency provides group counseling or individual counseling, that the therapist has to have certain levels of training. And one of them is that they need to have a master's degree. And so that is actually putting an onus on treatment agencies to hire people at a higher level. And one of the interesting ramifications of that is that people who are hired as LADCs, licensed alcohol and drug counselors, with the sort of background that we provide, for example, 5 years ago, a starting salary for that would have been around $50,000. And now agencies just cannot hire people at that salary anymore because they're scarce, they're in demand. And so, for example, I was just at Liberation Programs. I'm sure they wouldn't mind me talking about this. They're a friend of the program, but they were saying, wow, just in the last year, we've had people turning us down at 60,000, 65,000 because they can go into private practice, for example, and work there, or they can work with a local private practice that's already in existence. So the waiver is really causing some changes, Paul, in the level of care that is offered in the addiction field. And Vinny, I don't know, you may have had some direct experience with that as a recent graduate. If you would have any comments on that.
I don't have any comments specific to the waiver. I know Liberation, and I was up there 6 months ago, looking to help a client gain sort of an entry-level job there. And I was sitting with the gal who's the chief clinical officer. I told her I had just gotten licensed. She said, "We got a job for you," like on the spot. And I thought the range was 70 to 80 for the LADCs. So there's that. I'm not working for a public clinic, so I don't really know. I think there's a gentleman who I had met for coffee over a year ago, I think first name John, who is the CEO of MCCA. And he was kind of speaking similarly to what you described, that there was some type of pressure. I didn't know, whether it was legislative or insurance driven, to increase the number of licensed clinicians within the staff. So it sounds like what you're describing with regard to this waiver is sort of, it's becoming more real. But I don't have any, currently I'm working part-time with a gal who has her own private practice in Darien, and I'm working up in Bridgeport with Pivot Ministries under under the organization's license. So can't really, at least for today, speak to what a given public agency's requirements are, but I certainly was listening carefully to what you had to say about that.
Yeah, and I think that's a good example. When you sat down with was probably Joanne Montgomery, right? And they find out you've got a LADC. They're like, "Hey, we got a job for you. We'll hire you on the spot." So that certainly has been an encouraging thing for us to see the level of demand there is for our graduates. Even so, we're constantly evolving, and we're actually looking at a couple of new developments for our program for the near future. One is at Western Connecticut State University. We have a really, really good undergraduate social work department, but we've never had a graduate department. And we're exploring whether, in fact, we should start an MSW program that would be a dual degree with the addiction studies. So you would get social work graduates who would specialize in addiction counseling. And I think that would be an incredible thing for the state. We'll see if we can make that happen. And then the other area is we would really love to offer more of our training to folks online and take advantage of the work experience that a lot of the folks who are coming into our program have. People like Vinny, for example. And so we're looking at a collaboration with Charter Oaks to be able to offer the degree program online through them as well. So that's just a couple of sort of really interesting things that are happening. Paul, you said you had a couple of questions. Is there anything in particular you wanted to follow up on?
Well, we have two people that have raised their hands. So, Jacqueline?
Sure. Well, okay, so I have a couple of questions. The first question is, you're only in person. There is no online component.
Yeah, great question. So I should have probably addressed that. We are mainly an on-ground program. So all our courses are at nights or on Saturdays, so that we make it so that if people are working, hopefully they can still come to the program. But it does place a limitation for people that are in, the far reaches of the state. If you live up in Groton or something like that, obviously it would be a long distance to travel. There are a few courses in the program that are online. So our winter course is online, and both of our summer courses are online. And we also offer all our internship supervision online, so that our intern supervisors meet with our students while they're on internship online. But otherwise, yeah, everything is in person, and we like it that way because counseling is, still mainly a face-to-face. Even when we do telehealth, you really need those clinical skills of being able to pick up the verbals and the non-verbals from your client. But as I say, I think there's a real need for online training. So that's why we're looking at exploring a collaboration with Charter Oaks. And if that happened, it would be a fully online program, except for the internship, obviously, would still need to be in person somewhere.
Okay, so for instance, I work full-time at Liberation myself right now. I am a family recovery coach there. It is impossible for me to move anywhere, even within Liberation or outside, if I don't have some kind of certification or degree. And like you said, it's alphabet soup. I mean, I can go for a KSAC, I can go for a KDAC, I can go for an ADC, I can go for 1,000 different degrees. So I'm wondering, the idea of addiction studies is good. And then the fact that you mentioned a dual MSW and addiction studies, that's fantastic. But I can't afford not to work. So how does that work for me? I also don't want to be in school forever. So I'm trying to figure this all out for myself. Did you say that if the part-time program is 2 years to a degree or 3 years?
2 years, 2 years.
2 years. Okay. That's better than 3.
Yeah. And I think our program, it's interesting, the people coming in, they tell us why they chose us. I think the 1 year option is really great for some people that just, want to get the degree and move on. Some of our younger, students that come in fresh out of undergraduate really like that option. And we actually have an advanced standing track. So students that take the undergraduate curriculum that I mentioned earlier with us at Western, they can move into our program and take it in 31 credits instead of 37. We also offer that to anyone who's a DARC graduate. So DARC is the addiction and recovery program offered at the community colleges, some of the community colleges around the state. So we offer that. But you're right. It's very confusing, I think. And one of the things I'm always happy to do, is just email me and I will speak to you on the phone. I'm always happy to just chat with people about like what some of the options are. And I'm not in any way, shape, or form tied to, hey, people have to come here to our program. Like I often recommend, it'd be better if you went here. It'd be better if you went there or did this. And, KDAC is a step, and, certainly it's good to have. I think the reason, one of the reasons, again, why we started the graduate program is you can do so much more as an LADC in terms of being independent than you can as a KDAC.
So if that's okay, I just want to add one little question to that, which is I want to focus on family therapy. So really, I should be going for an LMFT, but I don't think that a lot of LMFTs have a strong focus or leaning toward addiction studies.
That's right. And that can be an advantage, right? So when there's not a lot of folks in that niche area, you can sort of distinguish yourself and make yourself a little bit different. And as I said earlier, in a typical MFT, marriage and family therapy training program, you wouldn't get much exposure to addiction. But again, you could do things on your own, go to conferences, go to workshops, you could even take a course with us in the summer, and make sure that you have some of that specialized training behind you, which would sort of set you apart from others in the field.
All right, great. Thank you.
You're welcome. And Patricia, you also had your hand raised.
Thank you. Yes, I'm actually joining from California. The benefit of the pandemic was I found this group, and although you're in person now, I join on these online things when I can. So thank you so much, Paul. Where I am, it's shocking how far behind we are in addiction support, recovery support. So the question I have for you is, I understand that licensing is state by state, but should education and training also be state by state? Or as someone from California, do I really need to find a program within my state?
It's such an interesting question. I'm probably the worst person to answer it because as an Australian, I'm always confused by the way we do things here in the United States. It's like, why do we have 50 different state requirements for licensure to be a drug and alcohol counselor? That makes no sense to me.
It doesn't, and particularly since we're so far behind here, if there's a way I can remotely do a high quality program in another state, I'd much prefer to do that.
Yeah, well, there are a few online programs. Capella University, for example, actually does have an MS in addiction studies, and they're a fully online institution. So as I said, our program is fully built around making sure people meet the requirements for LADC in Connecticut. We do also, like on our website and with our students, explain what some of the nearby state requirements are: Massachusetts, New York, Rhode Island. To be honest, there's not a lot of difference between them. There's just like little tweaks, usually here and there. Sometimes the number of hours differs and so on. There is a national association for drug and alcohol counselors, NADAC, and it's their exam really, or an exam that they sort of sponsor. That is usually the exam that people have to pass to become licensed in their particular state. So interestingly, they have two versions of the exam. They have like an entry level drug and alcohol counselor examination, and then they have an advanced drug and alcohol counselor examination. And in Connecticut, you only need to pass the lower level exam, whether you're KDAC or LADC. They don't require the higher level exam for the LADC people, which I find a little bit confusing. But you usually need around a 70 as a passing score on that exam. We've all of our students that have taken it so far, as I said, it's over 10 students already have always passed that. But you raise an interesting question, like, what should the knowledge base be that's a generally accepted standard? Now, NADAC have some standards that they're working on, and the waiver I was talking about is coming from another group that is in the medical profession that has a whole set of standards about levels of care, and that's where the push for higher levels of care has come from in Connecticut recently. I think we're seeing a lot more of that conversation nationally. So I think there is a push towards greater national standards. But at the moment, as you say, it's really a hodgepodge. It's crazy, and it's confusing. Some of the states have reciprocity, so that if you go to one state, they'll recognize your licensure from another state. I think there's about 29 states that have signed on to the main reciprocity organization, but Connecticut is not one of them. So we miss out there. It's a lot of the southern and western states that do that.
That's helpful. Thank you.
Yeah, sorry I can't be clearer about that, but it's so confusing that I find it too. Like, I'm a clinical psychologist, and I did my postdoc in South Carolina, so I got licensed there. And then I worked for the Olympic Committee for 10 years. So I was licensed in Colorado. And then I came back here to Connecticut. And for a while I lived in New York. So I was licensed in New York. Now I'm licensed in Connecticut. And I try to keep the licenses because you never know when you might need them. And they're all expensive. I will say, from my experience, New York wins the prize for being the most difficult licensing group to work with. They are very, very strict, and for no reason that I can think of. They just like making life difficult, I think, for you. But take that for what it's worth.
I was wondering if any of your graduates, or if you knew of any LADCs that are in emergency rooms at hospitals. That I find, just based on my own experience with the local hospital, that is a place where more medical people and more patients could utilize expertise in addiction and drug counseling.
Right. So I think collaborative care is really important in this field. And it's actually, we had a grant for our first 4 years, which was absolutely amazing. It was thanks to a PhD psychologist by the name of Lindsay Oberleitner that was with us at the start of our program. She wrote the grant and got it from HRSA. And it was a grant to actually, excuse me, emphasize interprofessional training and exposure to treatment for opioid use disorder. And so for 4 years, the last 4 years, right up until this year, we were able to pay each of our graduate students $10,000 for doing their internship, which was an amazing thing that we were able to get from the federal government. And you know, some of our students have worked in that sort of environment, Paul. Not that many. There's not that many placements for things like that. But just as one example, Kevin McVeigh at Nuvance. I don't know if you've come across Kevin, but he's an amazing guy, and he leads the community care team here in Danbury. So the community care team, what they realized at Nuvance is that a very small number of what they called high utilization clients were costing them a lot in emergency room treatment because they were coming back time and time again and using the emergency room and needing help. And a lot of them had substance problems, as you can imagine, and serious mental illness. So the community care team works out of Nuvance to try and connect these very, very needy clients with the resources that they need, whether it's housing, whether it's insurance, whether it's, job support and coaching. And they work with many, many, many different agencies. I think usually on the Thursday morning meetings, there's 15 different agencies represented here in Danbury. And they try and coordinate that as much as possible. So we've had interns there the last 4 years, I think. And in fact, the very first intern that we had there, Ben Stoller, was hired immediately after he graduated by Kevin. And so he's been there the last 3 years helping to train our students. So those students get an amazing experience of working in the emergency rooms, out on the streets, locating these very, very needy clients and helping them get just the resources that they need to put some stability under their lives. Because treatment won't even be effective unless there's some level of stability for those individuals. And we've also had some graduates that have gone to work in some really interesting programs, not so much emergency rooms, but one of the things I've been struck by is a couple of the court systems have hired our graduates to work as intermediaries between the treatment service side of things, the mental health care side, and the legal side. So they'll work in the judicial courts, they'll work in the drug courts, and they'll be able to pinpoint the folks who really need to be hooked up with support and services, and they'll be assigned to that client, and they'll sort of walk them through the whole process, get them in treatment if they can, find a bed for them if an inpatient is needed, and so on. And I think that's really interesting when we have law enforcement and the courts working with the mental health care side sort of hand in hand. And that has not always been the case. I would say, as recently as a decade or two ago, the law enforcement side was not really very open to being active participants in the mental health care side of things, but they are now. They really are. Like I'm on the Western Connecticut Coalition task force group that meets once a month here in Danbury, and law enforcement is always a regular presence at those meetings and always has a lot of really interesting input on how to help people with alcohol and drug disorders.
Is there a particular course that would address working with families in your program?
Yeah, this is an area I think that is more underserved in the drug and alcohol field than any other is providing support for the families of the person who's struggling in recovery. And we approach that in several different ways. We have a psychotherapy course where we train. This is a new one, actually, Vinny. You didn't get to take this course, so we just added it. But we train people in different models of intervention. And one of those models is family therapy. And family therapy is a really interesting approach. And it realizes that if you have somebody in your family, a child, a sibling, or a parent that is struggling, it's going to affect the whole family. And the whole family really needs to be supported in dealing with that individual who has the alcohol or drug disorder. So that's one way. And then we have a 4-course sequence that we call our counseling techniques sequence. And Dr. Gallucci teaches the majority of those. And one of the courses in that sequence is an individual and group counseling approach. And group counseling is very amenable to family interventions. But you know, to be honest, I think we could do more in that area, and I think we would like to do more in that area. So that's something that we're certainly building towards doing a better job at.
Right. And Patricia mentioned the ITC, Invitation to Change from CMC Foundation. Are you familiar with that, Shane?
It rings a bell, but no, I'm not familiar with it.
Okay. Well, the authors of the book Beyond Addiction came out with their updated version of CRAFT. And they call it Invitation to Change.
Oh, okay. Yeah, then I am very familiar with that. Yeah, CRAFT is one of the most evidence-based interventions that we have, and it's something that we include in our curriculum, and I think it's a really interesting approach. You know, the community and reinforcement approach.
If I could say a
Patricia,
further,
yeah.
if I could say a further word about that, yeah, I've been following their work since Beyond Addiction came out, and I was part of the first cohort that went through their level 1 training. And from a parent's perspective, who's been in this for a long time, it's the only program I've found truly supportive and helpful. And I've since started training other families who have been in Al-Anon for decades. And it's a remarkable program. And because it's based on CRAFT, but it also layers on motivational interviewing, parts of motivational interviewing and acceptance and commitment therapy, as well as other evidence-based therapies. So I just wanted to let you know how helpful that's been to me. And if you're going to do something for families, I'd really encourage you to take a look at that, because I think they're doing something really unique in the marketplace.
Yeah, I will add that I did that. I've actually gone through ITC training twice, once as a parent and then now as a provider. And it was very interesting to be taking it from 2 different perspectives. So, and I loved it, and I will probably take it again because it's just such a fantastic program. And it's just such a, to me, it's kind of the antithesis, of Al-Anon. And I, my apologies to anybody who is an Al-Anon proponent. But I for myself, Al-Anon did not work for me. And it was only coming to Paul's parent support group and going to different kind of support groups that I really found, my people and my way of working through what I was doing. And Invitation to Change was absolutely what I was looking for. CRAFT is a very, very different approach to Al-Anon, and for me, it's just what worked.
Yeah, absolutely. And I'm so glad to hear it. It's music to our ears, because motivational interviewing is a foundational approach in our program. It does make such a difference. And acceptance and commitment therapy is an approach that is part of my background as a cognitive behavioral therapist. The more modern approaches like ACT are really tremendous. They're a real strength. And we actually had a graduate, I think it was in Vinny in your cohort. So a local resource, Paul, if you ever want to get in contact with her, but her name is Deborah Heckman. And she, for her master's project, which is really like an in-depth semester-long deep dive into one particular topic that you're interested in. She chose family approaches, and she did contrast craft with Al-Anon, and then some of the more confrontational, intervention type family support programs, and highlighted all the differences. And it was really very interesting to see. And I know she's still deeply interested in that. Vinny, you have your hand raised?
Yeah, I do. And I would have sort of put a plug in, if you will, for Paul's parent support group. I think that approach is a wonderful approach. My experience has been people either love or hate Al-Anon, and it's just that I've had, I'm speaking from experience. I won't say which one I am, but I really like the approach of the parent support group. I think places like Turnbridge and maybe High Watch are really striving to put those types of parent support resources in place. By the way, there is also an entire course in this program in MS and Addiction Studies on motivational interviewing. And what I really liked about that course was at many agencies, you'll have trainings. They might be 30-minute training, they might be an hour training, and you'll always get one on motivational interviewing. But I never really understood and really could get my head around this style of counseling until I took that full course with Nick Gallucci. It really was one of my favorites, and it's something that I hope has made me, I believe has made me a better counselor. And I would just couldn't say enough good things about the MS and Addiction Studies program. I think, on one hand, it was a really good fit for me. The place that I was at in my life, I had a 30+ year career in financial services, moved into the treatment field 8 years ago, went initially the path of the Connecticut CADC, which was very good. I liked a lot about it. The MS and Addiction Studies program was not yet in existence. I worked in MAT, I worked at Aware Recovery Care, and then I went into some private sober coaching work. And at that point, I heard about the MS and Addiction Studies program, and it just seemed like a great fit. I think, an MSW program or an LPC or an LMFT, those are very, very substantial commitments. That is not to say that the MS and Addiction Studies program isn't a substantial commitment, but the 60 credits versus 37, it's a huge difference in cost, in time, and I think it may not exist today, but you and I talked about this over coffee. Maybe it was 6 to 9 months ago. Overdue for another one. But the potential for WestCon to offer a program that would bridge the gap between LADC and LCSW. But it's a great. I think it's just a great foundational piece of training and education. And if you're a young man like Cam, who I had talked to about the WestCon program, you can go back to school at any point. But it was a great fit, and I wanted to be particularly focused on addiction studies rather than broader social work or maybe family work. Of course, that is an important piece of the equation. But I really just wanted to say I loved the program, and it's opened doors for me. So Thank you for that.
Thank you, Vinny. Well, Vinny is a good example of the sort of student that we love. I always say with any educational program, you get into it what you get out of it what you get put into it. And Vinny is sort of like that open-minded, inquiring, lifelong learner type that we love to have in the program. And even the 37 credits, I would say it's still quite a commitment. So, we do encourage people to think carefully before coming into the program as to whether it's right for them or not. But one of the really interesting things too is the diversity of students we have in our program. I mean, we have everybody from 22-year-olds to, I won't even say, some of the 60-year-old ages that we have in the program, and everything in between, and all sorts of backgrounds. I mean, I would say about half of our students themselves are in recovery, which is fine. And we try to have some extra supports, for those people, and some reflective exercises and experiences on the way through, so they can sort of connect their own life journey with some of the things that they're doing in terms of learning about interventions in this field. So it's I've learned so much, I must say, Paul, from this journey. As someone, my own background is I lost my brother 30 years ago now to an overdose. He was only 2 years younger than me. And I always think every day that if, some of the resources that were around today, like Narcan and so on, were available then, he'd still be with me, and he would have been at my daughter's wedding last month. So I've just gotten so much out of being part of this program. And I really thank you, Paul, for inviting me to talk about it tonight.
Yeah, no problem. Liza will ask the last question of these.
Oh, goodness. Well, my question actually was what you just answered about where some of your students come from and how they find you. But I just also wanted to say, I have a son in recovery, and I'm just so grateful to you for starting this program and helping, I'm sure, already countless individuals and families. So just, I feel a lot of gratitude. And I just have a comment, which is really kind of outside of your job, but when you've talked about the alphabet soup and so many different degrees and titles and license, I wish when we had started this journey, I had been a lot more knowledgeable. And I'm a big researcher, so I've done a lot of reading and everything, but I would love, I don't know how many years ago, 5 years ago, for my son to have ended up with one of your graduates somewhere. So I hope, and I think Paul has done so much in our town to educate all of us, but I hope that continues to, the word gets out. I just, thinking about some of the therapists we've had who've been great, but to hear that they may not have had much addiction focused training it kind of makes you a little nervous. But anyway, thank you.
Thank you so much for saying that. And I guess one thought I have about that is, one of the reasons we started this program was, traditionally or historically, drug and alcohol counselors have tended to sort of be at the bottom of the totem pole in the mental health field. There's a lot of stigma, even to this day, around drug and alcohol disorders. And it's not a field that, frankly, a lot of people find attractive or they want to go into. And we just felt like a new program with a different approach and really evidence-based could help, perhaps raise the standard in the field. And one of the things we really, I think, will happen is that our graduates will sort of become leaders, hopefully in the state of Connecticut, and they'll keep pushing that bar higher. So there is better treatment, more informed treatment out there.
Yeah, which is critical. Have other colleges and universities reached out to you? Because it just seems like this is such an amazing program and so timely with everything that we're struggling with.
Well, the main one that has just recently is Charter Oaks, and we're in active conversation with them, because I do think there's a real possibility. There's a real need for meeting the needs of folks, maybe like Jacqueline, they're working full time, that have some experience already in the field and could put their degree together with through a place like Charter Oaks. So, but yeah, I think certainly my colleagues, psychology colleagues at the other universities, they are very interested. But again, this is a very specialized program, and I don't think many other places are in a place where they could take that on, to be honest.
Yeah. Well, thanks to you for doing it. So thank you very much, Shane. I'm going to give you a round of applause. Thank you. And
much appreciated. You can probably tell as an Irish Australian that I don't mind talking and having conversations. I love meeting people, and it was great to meet all of you tonight.